How long will you do this? This will be, I believe, for about a half hour. About 28 minutes or so. Take time. This half hour, right?
28 minutes.
28 minutes.
The following is a special video presentation of the Hennepin County Library.
Hi, welcome to a discussion with Armond Budish. I'm Eileen Cavanaugh from the Hennepin County Library Program Office, and my guest today is the author of Golden Opportunities, Hundreds of Money-Saving Gems for Anyone Over 50. Welcome, Armond.
Thank you very much.
Can you tell us about, obviously the book is for people over 50, but more specifically, could you tell us who would benefit from this book?
Well, actually, it's for anyone over 50, but there are also a lot of gems, tips, strategies for people under 50 as well. It's never too early to start looking towards your retirement. In addition, in my legal practice and in my the calls and letters I get, I find that actually a lot of people who are in their 40s, 50s, 60s come in or want this kind of information, not just for themselves, but for family members, particularly parents. A lot of times with health-related benefit programs like Medicare or Medicaid, for example, when a parent becomes ill, that's the time they can't handle these kinds of programs themselves. They need the benefits, but they need some help. So often it's a child who may be getting up in their years, but nonetheless a child coming in for a parent.
And with the sandwich generation now, that child may be in his or her 60s as well.
That's right. I've had people come into my office that look older than the sea, and I say, what can I do for you? And they say, no, it's not for me, it's for my parent.
Well, say I am 60 years old and I want to retire right now. I don't want to wait until I'm 62, but I do need that income that Social Security provides. And say I have a house that's worth about $80,000. Is there a way for me to live between 60 and 62?
Sure. There are, again, a variety of programs that offer golden opportunities. There is, first of all, if you're in the situation where a spouse has died, you're eligible for survivor benefits under Social Security starting at age 60, and it would probably be a good idea to get those. If that doesn't apply to you, there are still ways to supplement your income. There are other programs, depending on what your other income is. You might look to something like Supplemental Security Income, SSI, for certain people. If you have a house, that's a source of income, even though it's a house. A lot of people have this great asset out there, this treasure house of value. It's got equity built up, but they may not have enough income to make ends meet, or they may need some additional income, at least for a period of time, as in the situation you described. It's a shame to have this wonderful asset, this house that you can't touch, unless you sell it. And you don't have to sell it, because there are a variety of ways to cash out equity from your home, either on a temporary basis, periodic for a couple of years, or for the rest of your life. One very nice technique is through the use of what's called a reverse mortgage, which is sort of the opposite of the standard mortgage that we've become accustomed to. With a usual mortgage, you take a big lump sum against your house. It's a big debt, and you pay it off for what seems like the rest
Forever,
of your life.
Yes.
With a reverse mortgage, you don't take a big amount of money. Instead, you get basically a monthly income from the house. It's a loan. It's not a gift from heaven, but it's a loan. The debt grows over time, but you don't have to worry about being foreclosed. You don't have to worry about having to pay it back before you either permanently move out and then sell the house, or before you die and then the family sells the house. At that point, the funds from the house can be used to pay off this debt. But until then, you've basically tapped the equity in your home while you can still live there. And a lot of people want to keep living in their homes. So it might be an option for the situation you described.
Would that work even if you had an existing mortgage?
It might work if you have an existing mortgage. Most people, when they get to the 60-year-old category and up, if they have a mortgage, it's relatively small and it shouldn't interfere.
Interesting option for people.
It is an option. It's been around for a while. The problem has been that there hasn't been a lot of lenders that have been willing to make reverse mortgages because it's something new and they don't really always want to get into new things. But as of about 2 years ago, the federal government started guaranteeing these loans to lenders, and that has opened up the field substantially. Every month, new lenders are coming on board, and there happens to be a very good nonprofit organization in Minnesota, which we have an address and a toll-free number that you can contact this organization listed in our book, and for like $1, you can get a list of lenders in your particular locality that are making reverse mortgages now. It's a wonderful option, at least worth exploring.
I should comment while you're talking about that it's this wonderful reference book to have, because there are lots of sources, names and addresses, as well as all the gems and examples that you can plug yourself into to see if it applies to you. So it's really a great book to have around your house for as you mentioned, either your parents who may be in those situations or yourself.
I appreciate that. I like to think of it, like when our parents had that medical encyclopedia, and when there was a pain or an ache, you'd go to the encyclopedia, pull it out. Well, now sort of a role reversal. Now it's often the kids, when the parent has that ache or pain in their financial situation, pulls out the book and looks it up.
It's also kind of conversation piece I found just in preparing for this, that I'd have it on my desk and people would come in and offer me questions to ask you about.
Great.
So it almost has a coffee table book aspect
well,
too.
It's just, I didn't intend it to get so big. I mean, my wife and I both worked on this book. We're co-authors. In fact, I should mention that, give my wife due credit, both of us. It was just shocking to me, and I work in this field. I mean, I am what's called an elder lawyer. I deal with elder law, with problems of senior citizens and their families on a regular basis. I was amazed at how many benefits that people are missing out on under all the different programs. We didn't intend it to be such a huge book. It just grew because we kept finding more and more and more benefits, gems, strategies, tips that people should know about that the government doesn't tell us about. And it's a shame because people who need the money or who could really use the money are missing out on very significant benefits.
And these are things we're legally entitled to. It's not a matter of bending the law. Right?
Absolutely. It's not bending the law. That should be made very clear. I'm glad you brought that up, because these are tips that programs that the government has created and said you're entitled to. This is what you should be getting. And then people never find out about them.
One tip that I found immediately useful was the idea that if you're over 59 and a half, you can put some money, even non-deductible money, into an IRA and then just use that as your liquid savings account.
For some people that can be real useful, yes.
And save a little money on taxes on the side.
That's right. Putting money in tax-deferred vehicles generally, like IRAs, like your company pension plans and profit-sharing plans, are wonderful, even for older people, even for younger people. I find that many younger people aren't utilizing their opportunities, their golden opportunities, as often as they should. Many younger people should be taking advantage of their company pensions and profit-sharing plans, the IRAs, even if the company doesn't match, even if the IRA is not deductible. It's still a way to have your income grow over time on a tax-deferred basis. It's invaluable. Many younger people, I think, don't do it because they're afraid, what if I put the money in, then I can't get it out until I'm 59 and a half without a substantial penalty.
Which seems like forever to a 20-year-old.
But the fact is that there are ways to get the money out earlier. A lot of younger people don't understand that. But company plans, many of them allow you to borrow funds against the plan. So if you need it for college tuition or for medical bills or something like that, you can get it out. IRAs you can't borrow against, but there's a program called Substantially Equal Periodic Payments. You can take money out from an IRA before age 59 and a half based on your life expectancy, And it's small amounts, you know, it might be a few $1,000s, but at least it's something so that if you do have those medical bills or college payments or business opportunities or vacation trips, whatever it might be, younger people can access their funds before age 59 and a half without penalty. It's important to understand more young people should take advantage of these nice opportunities.
One of the things I've heard young people say, and even not so young people say, is what's the point in saving money in 1993 when maybe you're getting 1-2% interest on that money? Might we not just as well buy things that are going to cost more later on anyway?
Well, first of all, if you're only getting 1 or 2%, you're doing something wrong, because even with interest rates as low as they are, even government bills and notes are paying higher than 1 or 2%, so you should be doing better than that. As we just said, if you can take that 1 or 2% or 4 or 5% more realistically and accrue that income on a tax-deferred basis, that 4 or 5% starts to equal 6 or 7%, which is even better. And younger people need to understand that while Social Security will be there when they get older, and I don't like this fear-mongering that's going on right now, Social Security will be there for younger people. It is solvent. It is projected to remain solvent. But the fact is that Social Security benefits are not going to pay for every need that they have, that younger people have, and we need to be saving.
Even today, that's true. That
Even
Social
today,
Security
it was never
is not.
intended to be the entire retirement income for people, and it's not, and it can't be.
Well, it's interesting that you say there isn't a fear of losing Social Security, because a lot of people certainly do fear that.
Well, there is a fear, but there shouldn't be.
And people
I
are saying,
think
well,
it's
what
solvent.
about the ratio, though, that says by the year 2000 that there's only going to be one person working to support 3 people on Social Security?
That is real, and the fact is that is why it's important right now that Social Security is taking in a lot more than it is paying out, and it needs to continue to do that, and it should be doing that without taking the money that's coming in and putting it in IOUs and taking the money to pay off the deficit.
What do you consider the 3 most important issues in preparing for retirement?
There's a lot of issues in preparing for retirement.
I shouldn't limit them to
One of the
3.
ones that's right, it's hard to limit, hard to pick. One of the ones that I get all the time question is, as I'm getting closer to take my retirement fund from my company, should I take it as a monthly annuity for the rest of my life? Should I take it as a lump sum, one time? Most people take a monthly annuity. Most people are making a mistake. I think it's very important that people have control in general of their fund, and that means taking the lump sum. Now, if you're the type of person that money comes into your hand and disappears, then take the monthly annuity. You don't want control of your funds. But for most people, having that control is very important. For example, if interest rates go up, if inflation increases, and I don't know anybody that doesn't think interest rates aren't going to go up in 10 or 20 years, if you've locked yourself into a fixed monthly annuity, you're stuck. It's not going anywhere. But if you've got the lump sum, you can change the investment and get more, take advantage of higher rates, and basically protect yourself against inflation. If you are unfortunate enough to get sick in this country and need nursing home care, if you've got a monthly income from a pension coming in, all of that money is going to go to the nursing home. Every penny. Even if you can otherwise qualify for Medicaid benefits, your income still goes to the nursing home. But if you've got a lump sum, you've got control. And that means you can utilize some of the planning strategies that are available with a savings, with a monthly annuity. We have a whole chapter in Golden Opportunities that talks about maybe 20 different options that people have to protect savings, which includes a lump sum pension. So if you've taken a lump sum and later, 10 or 20 years from now, you need nursing home care, you can protect a portion of your savings, but not if you've taken the monthly annuity. There's a variety of reasons. I'm a big advocate for taking a lump sum over the monthly annuity if you aren't the kind of person that spends money as fast as it comes in.
And that's really important with people living so much longer today than with a 300% increase in people over 90, which is kind of scary.
That's right. Well, that's probably the biggest reason why healthcare-related legal issues have become such a big item these days. nursing home charges, Medicaid has become a key part of planning, in large part, in my view, because people are living longer, not necessarily healthier, but longer, and nursing home costs have gone up, and medical costs generally have gone up so high. So when it comes to planning, one of the key areas now is nursing homes, because at a cost of $40,000 a year average nationally, most people can't pay that out of their income. They need to go into their principal, and they end up spending their entire life savings unless they do take some steps to protect it. The good news is, and I want to be very clear on this, there are planning options available, even for your viewers that right now have people in nursing homes, relatives, friends. There are probably things that can still be done to protect a portion of the savings. Even then. Now, there's always fewer options if you're already in a nursing home. The earlier you start to plan, the healthier you are when you plan, the more options that'll be available.
Well, and one of the interesting things about having your book at hand, too, is that it sort of takes care of some of the ignorance that we have about these laws and these possibilities, which sort of leads me to ask about the abuse of things like ads and mailers that promise things they can't deliver, and generally are geared to people who are at an age where they don't have the knowledge to decide whether this is the right or the wrong thing to do, and also the pressure tactics of some of the salespeople that
it's sad, because there seems to be a rebirth right now of these, or a rejuvenation of these various scams that are directed primarily towards older people. One of the worst abuses, thankfully, has been taken care of, or at least pretty much taken care of, and that was Medicare supplement insurance salespeople. When Congress was considering legislation to correct that problem, there was testimony which was unbelievable. People being sold 20 and 30 duplicative policies that they didn't need. They needed one policy, and they were being sold 20 and 30 policies. Thankfully, that problem has been minimized now, because the federal government passed legislation to create some uniformity among these policies, and to require that you can't be sold more than one Medicare supplement insurance policy. Very important. But there are a host of other abusive scams, I'll call them, out there. I had somebody come into my office the other day who wanted to do estate planning for her $10 million that she was sure she was going to win from one of these publishers things that are going out there, and she brought in the material, and it almost made it sound like she did win. They're talking about, you're a finalist now, and many other people have dropped away, but you're still in it, and when you win your money, how do you want it, in a lump sum or in annual payments of so much money? You need to select now because the time is coming close. And I mean, very misleading. And while that was less damaging, I mean, the worst there is that she bought some magazines that she didn't need to buy. But there's a lot of abusive scams going on. Thankfully, your Attorney General's office and those of other states are on top of it, are watching out, and are trying to, as the best they can within the resources available, protect older citizens.
What's your advice for people who get confusing information in the mail that sounds good, but they question it, they're unsure?
I would either talk to maybe a family member that can understand it better, if there is somebody. If necessary, you can send it to your Attorney General's office or to the Federal Trade Commission regional office, and even possibly have a lawyer look at it.
And again, those sources are listed in the book?
Absolutely. We try to give people, we first try to explain all the programs in plain English. We also give people a lot of different places they can go for free or low or no cost for additional information, numbers, information, written information. Local libraries are wonderful places to go for more information. And in our book, we try to give people a wide range of places that they can go.
Let's get back to Social Security. What are the pros and cons of retiring early? I think you have, it sounded like a hard and fast rule that said, take your money and run.
Take your money and run is generally the golden rule here. Most people are aware that if you retire at 62, for example, you're going to get less. You're going to get 80% of what you would get if you wait till 65, and even less than what you'd get if you waited till 70. Most people wait. Some people wait that don't have to be waiting. Some people wait. Some people are even out of work and are just waiting to start their Social Security because they think they're going to do so much better with this additional increment. Not true. By waiting, you lose. You lose out on those checks from age 62 to 65, 3 years of checks. When you add that amount together, that's a lot of money. Statistically, government statistics are that it takes about 17 years on average to make up for those lost checks by the increment that you're getting. 17 years. That puts you out to 82 before you break even. A lot of people don't make 82. Most people are better off starting early, and they can use the money earlier too.
Plus which, it seems to me that 62 to 65 are some prime years when you might like to do some more expensive things.
That's right. Now, if you need to keep working because you need the added income, or if you love your job so much that you want to keep working, do it. And don't take your Social Security benefits usually, because the government hammers people who are getting their Social Security benefits and are working and are under age 70. They take away what is effectively about 50 cents on the dollar, and that's too much. Now, there are some things you can do. We do have strategies to help cut that down, but the best strategy there is don't take your benefits then if you're still working.
Now, what about, do you have to pay taxes on Social Security if you have other income? Say I have a pension, a modest pension, and Social Security and some money that I've saved. How do I manage that so that I don't have to pay taxes on Social Security, because I already pay taxes on Social Security? Well,
we're going to see probably an increase in the tax on Social Security. The fact is that Social Security benefits are taxed for people who have income, for individuals with income of $25,000, for couples with income of $32,000. We already have a tax on 50% of the benefits. That tax is likely to go up to 85% of the benefits. That's a stiff tax. It's a very stiff tax. Again, there are strategies available to cut or eliminate that tax, but most people don't know about these things, and they need to. It's very important. Again, this is money that we need. Some of the strategies involve staggering your investments so that monies come due at different times, which are advantageous. And we go through examples. It's a little hard to explain the ins and outs of the finances on television, but when it's laid out in front of you with examples, it's a lot easier to follow.
But the basis of it would be to find a way to keep your income under, say, $25,000 with your supplemental
Correct.
earnings, and then you don't have to pay tax at all on
That's
your
right.
Social
And
Security.
there are ways to do that.
Sounds good to me. What's going to happen to health care, do you think, in the next 5 years? Where do you see it in your crystal ball?
I'll look in my crystal ball. It's hard to say. I think that we're going to see some major changes in health care for those 37 million Americans plus that don't have any health insurance, and I think that's very positive. I can't tell you what the system's going to be because I don't think anybody knows yet. For older people, I don't think we're going to see substantial changes, and that's a little bit unfortunate because while the system is good, it could certainly be improved, especially in the area of long-term care. We've talked a little bit about Medicaid and nursing homes. Medicaid is the program that covers right now. It's a good program. It requires people, though, to do some maneuvering that is unfortunate, but it's better than not having a program. I would like to have seen long-term care included in the Hillary Rodham Clinton Commission proposals. I don't think it's going to be. I don't think we're going to see any change in that regard. At least that's what's being reported now. In terms of what the shape of the health care program is going to be for all those people who don't have health insurance, very hard to say. I think there's already a wonderful model out there, which is not being looked at. We're looking to Canada, we're looking to this. We have a single payer plan in this country right now. It's called Medicare. and it works reasonably well. Now, I am critical of the way it's administered in many occasions, but it's a reasonably good program. The cost of administration is significantly lower than many other options, and I think would be worth considering extending to those 37 million other people.
And then you wouldn't have to set up a new administration.
That's right.
For
And
it.
it's not socialized medicine. You're not having doctors working for the government. You can use your private doctors. There's caps on what the costs are. There's already caps right now under the Medicare program. Reasonable costs that doctors generally can live with. It's a good program, nice model.
What about a child's responsibility for, financial responsibility for a parent that needs long-term care?
Right now, thankfully, children do not have legal responsibility for their parents' costs. And that's, I say thankfully, because you're talking about, you know, that cliche about the sandwich generation is really true.
Many of those people are themselves preparing for retirement.
Preparing for retirement themselves. Many of them are taking care of other dependents, like children who are still in school. It's not easy out there these days. And to require these people then to start paying for parents' long-term care costs would be a killer for many of them. Thankfully, that is not required. Many nursing homes are having children sign contracts that say that they will take on the obligations. That's a problem. I encourage people not to sign those in their own names. Let the parents sign it. The parents are the ones that are responsible and should be so. If, however, a child is forced, and I say forced with intent, to sign one of these contracts, they should keep in mind that there have been lawsuits around the country where these contracts have been voided if the parent is subsequently becomes eligible otherwise for Medicaid benefits. And that's good, and children should understand that and know that. That's an important tool.
One quick question before we have to end. Why is the retirement age going up for people who were born after 1938?
Retirement age is going up because they're trying to conserve the assets in the Social Security funds for the very reasons you mentioned earlier, that we're having fewer and fewer workers and more older people. And this is one of the ways that that the government has already decided to go to extend the funds in those programs.
Well, Armond, thank you so much for all the handy hints. They've been wonderful, and for even more to be found in Golden Opportunities. Thank you.
Thank you very much. My pleasure.
A presentation of the Hennepin County Library.